Hello, and welcome to Tia Badger and Marcia Heron's presentation on midwifery for the class Advanced Role Development at Morningside University, instructor Dr. Carrie Varner. We hope you enjoy it. Midwifery practice and the APRN role involves the independent management of women's health, focusing on pregnancy, childbirth, postpartum care, newborn care up to 28 days, about 4 weeks of age, family planning, and gynecology. Providing holistic, family and community-centered care, supporting natural birth processes. It emphasizes health promotion, normal birth management, early detection of complications, and appropriate referrals. In regards to practice autonomy, full practice authority allows midwives to practice independently based on their education and training. However, some states require midwives to work under physician supervision or collaboration, either generally or for specific services like childbirth or prescribing medications. Limitations on prescriptive authority undermine true independent practice for midwives. In Michigan, while only prescribing technically requires physician oversight, it is often interpreted to mean that midwifery as a whole must be supervised. This misinterpretation restricts midwives from opening practices, especially where physician collaboration isn't available, and creates confusion about provider roles and accountability for both patients and pharmacies. Midwives practice in multiple settings, providing holistic, family, and community-centered care, and support natural birth processes using medical interventions only when necessary. Most midwife-attended births in the United States occur in hospitals, though care can also be given in homes, birth centers, clinics, or offices. Midwives ultimately aim to empower women through their care. In order to be recognized for clinical practice, midwives must complete an educational program that meets legal requirements specific to their country. In the United States, this includes graduation from an accredited midwifery program recognized by the United States Department of Education, passing a national certification exam from a certifying agency accredited by the National Commission for Certifying Agencies, American Midwifery Certification Board, and meeting state-level legal qualifications for licensure to practice midwifery. Certified nurse midwives, or CNMs, provide comprehensive healthcare services to women and individuals seeking midwifery care, from adolescence through menopause and beyond. Their scope includes primary care, reproductive and sexual health services, pregnancy and postpartum care, newborn care, and treatment of STIs, including male partners. CNMs also care for transgender and gender nonconforming individuals and may offer medication-assisted treatment for opioid disorders. They are qualified to assess, diagnose, treat, prescribe medications, order tests, and manage patients in various settings. They must meet the American College of Nurse Midwives core competencies and standards, and may expand their practice through additional training in advanced skills such as ultrasound or surgical assistance. There are 8 standards of care for midwives. Standard 1, the midwife is certified by the ACNM authorized certifying body, maintains ongoing competency, and adheres to the legal requirements of the area where they practice. Standard 2, The midwife provides care that aligns with legal and safety standards, ensuring proper infection control and access to medical support through consultation or referral. They consider a range of factors, including medical, cultural, and social, that impact the patient care. The midwife also integrates community resources, manages emergencies effectively, and supports the active involvement of family and support persons in the care process. Standard number 3, the midwife practices according to ACNM's philosophy and ethics, informs patients of the scope of midwifery services and their rights, refers patients to other providers when needed, and provides information to support informed healthcare decisions. Standard number 4, the midwife provides individualized care by assessing clients, creating and implementing care plans, and evaluating outcomes. They apply appropriate clinical skills and judgment, practicing according to ACNM standards. Continuing the standards of care for midwives. Standard number 5, the midwife documents care protocols and transfer guidelines to ensure access to evidence-based resources for clinical practice across areas such as women's primary health, maternity, and newborn care. Standard number 6, the midwife ensures accurate, timely, and confidential documentation to support communication and continued care for all parties involved. Standard number 7, the midwife engages in quality management by collecting practice data, seeking consultation in peer reviews, and taking action to resolve identified issues in care. And standard number 8, the midwife evaluates the need for new procedure based on demand, safety standards, and staff availability. They ensure compliance with legal and institutional regulations, demonstrate knowledge and competence in the procedure, and establish a system for medical consultation and referrals, while documenting acquired, maintained, and required skills and competencies. With any healthcare role, midwives must also meet professional and policy standards while upholding the core values of offering personalized, high-quality, evidence-based care to women. When midwives work with a mother who would prefer a home birth, a whole spectrum of safety issues can arise, from medical emergencies for the mother and/or the baby, and the realization of not being in a hospital setting providing backup birthing staff, response teams, and emergency equipment. Today, midwifery is a demanding role due to rising births, staff shortages, and complex cases. Although the birth of a newborn is always a joyous and special occasion, there can be the dark times when there is a loss of the baby, mother, and/or both. The midwife needs to be prepared for such times and be able to comfort the mother and her family for such a loss, as well as coping with the loss of their patient themselves. Collaboration of roles in the birthing process can include a plethora of healthcare team members, depending on each individual case. Midwives use consultation in their practice to ensure the best outcomes, or when circumstances arise that may affect the welfare of the fetus, the mother, and/or both. For example, if the midwife identifies inadequate fetal growth, they will consult the obstetrician, who will more than likely need to assume the main role of care. The midwife will still participate in the person's care to a larger degree, focusing on the emotional support, counseling, guidance, and teaching. Other roles that the midwife may collaborate with would be doulas, who will provide labor support in the laboring mother and her family. However, doulas do not offer medical care or advice. During the intrapartum and postpartum periods, the nurse midwife will collaborate with maternity unit managers and nurses to develop the best birthing plan for mothers following the unit's policies. They may also consult physical therapists or massage therapists to alleviate back pain of the pregnant patients. Physicians will often consult midwives for collaboration on ideas on complementary therapy options, such as with breastfeeding strategies or birthing options, such as water birth. Other healthcare team members' roles that may be involved in the birthing process are lactation consultants, nutritionists, psychologists, cardiologists, and endocrinologists. What does the midwifery role future look like? According to the World Health Organization, or WHO, midwives are extremely important and a vital part of reproductive, maternal, and newborn health. And though midwives and nurses make up 50% of the healthcare workforce, there are less than 40 nurses and midwives per 100,000 population in 55% of the WHO member states. The World Health Organization further reports that by 2030, the global shortage of midwives will be heightened in developed countries. The future of our artificial intelligence interweaving with the medical world continues to grow. AI has not been implemented completely in midwifery, but the potential is there. One way AI could be utilized for midwives in the future is by enhancing clinical education with personalized learning tools, such as the use of virtual patients in assessment training. Another study on expanding midwifery care in the United States reiterated that midwifery care is likely a lower cost overall due to the lower risk of cesarean births, inductions, epidural use, and/or episiotomies. That being said, the study estimated that expanding midwifery use to 100% in the future for low-risk births within the United States could save as much as $340 million per year in birthing healthcare costs. Sadly, the role of midwife has been misunderstood and underutilized. This concludes our presentation on how midwives play an essential role in delivering high quality and individualized care to women throughout pregnancy, childbirth, and postpartum. Their advanced training allows them to manage both normal and complex situations while promoting health education and patient autonomy. By integrating evidence-based practice with compassionate care, midwives contribute significantly to improving maternal and infant outcomes. The APRN midwife is a crucial member of the healthcare team, dedicated to supporting women's health and well-being at every stage. Thank you. We hope you enjoyed our presentation on midwifery, and we were able to enlighten on how this profession has evolved.